If you're on Medicare or you're about to be, this video can save you thousands. Most people don't realize this, but some of the biggest Medicare mistakes aren't that obvious. By the time you notice that you've made it, it's already going to be costing you some money. So in this video, I'm going to walk through the top 5 most common mistakes that I see, and we're going to talk about, more importantly, what we can do to avoid them. Medicare definitely isn't as simple as it looks. Some of the smaller decisions that you make at the very beginning and ongoing throughout the process can really cost you over time. And so what we're going to do is just going to kind of slow down a little bit and kind of go over these, tackle them one at a time. So the first one we're going to talk about is actually missing your enrollment window. A lot of folks know that their initial enrollment period is when they turn 65. But there are some waivers that come up that you may or may not know about, right? So if you're going to continue working, you don't have to get on Medicare B, which is the one where you pay the premium for. You don't have to get on that right away. But if you're not actively working, or if you're working for a small employer, this is the one that catches people all the time. If you're working for a small employer, you may not qualify for that waiver. And if you miss your enrollment window by, each year you miss it, it's a 10% penalty. And that's the premium that you pay for the rest of your life. So you really need to know your timeline. You need to confirm that you have creditable coverage and speak with an advisor early on in the process to have them help you navigate it. The second one we see a lot is choosing the wrong Medicare path, making the choice between original Medicare, a Medigap, and a Part D plan versus Medicare Advantage. That can be a long-term decision, and sometimes you're not considering network restrictions or high out-of-pocket costs or problems that arise if you have to switch later. So these things compound over time, especially if you choose the wrong path. It's not necessarily always an easy choice, and it's not one that it may change every year. We're actually going to get into that in a little bit too, about how it changes every year. So what you really want to do is you want to make sure you're thinking long term. You're comparing total costs, not just premiums. So especially when you're considering a Medicare Advantage versus a Medicare supplement, you're looking at the long-term picture of what your total cost is going to be, not just what's coming out of your pocket in premiums on a monthly basis. The next mistake that we see a lot of people make, and I hear it come up all the time, is skipping Part D prescription drug coverage. Even if you don't take medications, you need to get Part D drug coverage. As a matter of fact, it's one of the things that the federal government states you have to do. If you have Medicare A or Medicare B, you have to get prescription drug coverage or Part D. If you don't get it when you're initially eligible and you waive it, there are penalties. Just like the Part B, there are penalties that come into play that you pay ongoing for the rest of your life. One of the remedies to that is to really just, even if you're not using any prescriptions, is just, if you're going that route where you have to have a Part D coverage, it's not part of the Medicare Advantage plan, just work with your advisor, work with somebody to get the lowest costing possible plan for you. And then you can change it when your situation changes. Which leads us to the next point, and that's not reviewing your plan on an annual basis. Everybody's life situation changes all the time, as well as all these coverages. Medicare Advantage plans change on an annual basis. So if you're enrolled in that plan and your situation changes or your plan changes, you need to make sure that you're addressing that every year. During your annual enrollment period, which is a period of time between October 15th and December 7th every year, just do a check. Just run through all your benefits to make sure they're still meeting your needs. And don't skip out on the annual notice of change letter that you're going to get from your provider. If you're on a Medicare Advantage plan or Part D plan, you're going to get that annual notice of change, or ANOC, A-N-O-C. A lot of carriers send it to you in bright colored paper and big bold envelopes so you don't miss it. Don't skip that. Read it. And the last one, this is the one that it comes up all the time in conversations I have with folks, is that they assume Medicare itself covers everything. Medicare by itself, there's a lot it doesn't cover. It's not going to cover any, number one, it's not going to cover any dental expenses or vision, any hearing, long-term care expenses. Original Medicare does not pay for that. Also, original Medicare has some holes in it. If you go into the hospital, there's a upfront deductible that you typically have to pay on a per benefit period basis that kind of gets adjusted each year. And then if you're on a Part B plan, there's also a 20% coinsurance. So there's lots of things that it doesn't pay. I actually kind of surprised me when I was first learning about Medicare plans was there's no out-of-pocket max. There's no annual cap on what you'll pay on original Medicare if you just have Medicare coverage. that can be very costly. So that's what I was telling you at the very beginning. Like that one's one that could cost you a lot of money in the long term if you really think that Medicare by itself is going to take care of all of your needs. And how to avoid that again is being strategic when you're looking at things initially. You want to have that full strategy where you fully understand what each plan is paying, whether a Medigap with Part D best works for you or Medicare Advantage. So, I mean, really in conclusion, I mean, Medicare decisions really end up being a financial decision, right? So it's something that you can't just look at and go, oh yeah, that's the nicest plan. It's a process that you shouldn't take lightly, and you need to consider all your options. I know it's confusing. I jokingly say to a lot of folks too, because I do sit down with a lot of folks, it's really not fair. Most of your working lives, you end up having, your employer's making your benefit decisions, you're making your health insurance decisions for you. All of a sudden you hit this magic retirement age of 65 and you have to get Medicare and you have to get this other. And so it's like, now your employer's not making your decision. You have to make the decision yourselves. And you have to deal with the two most confusing entities on earth, which is the American healthcare system and the American government. So good luck with that, right? The good news is that you don't have to walk this walk alone. We here at Cornerstone Health Advocates, we can walk this with you. We can help you in your decision-making process. So again, a quick half-hour consultation with us can help you avoid all of these moving forward. So thank you very much. Have a great day.